done here to assist in the fight against COVID-19 and many, many other maladies is incredibly important, not just for Massachusetts, but for states and communities nationwide. I'd also like to thank Senate President Karen Spilka for joining us today and for her continued work on behalf of her district and the Commonwealth during this public health emergency. I'd also like to just give a quick update on testing and hospitalization. Yesterday we conducted and processed 6,339 tests, which brings our total to just under 400,000. We believe the number of tests that were conducted was a little lower because people probably didn't go out and get tested on Mother's Day. Of those over 6,000 tests that were processed, 669 were confirmed positive, or about 12%. That's certainly within the range that we've been seeing for the past week or so, and is certainly, from our point of view, a continued step in the right direction. We continue to have daily conversations with our partners in the healthcare community to monitor hospitalization rates and capacity. The number of cases currently hospitalized remains at about 4% of those who test positive. And while that sustained low rate of hospitalization is promising, we also crossed a sobering and sad threshold yesterday with more than 5,000 individuals who have died here in Massachusetts as a result of COVID-19, and obviously our hearts go out to their friends, to their families, and to their loved ones. We remain, as we've said before, one of the hardest hit states by the COVID-19 pandemic, and we still have a lot to do and a way to go to contain the infection rate and reduce the number of people who need serious hospital care. And obviously, we continue to monitor information daily on ongoing trends to help inform our next steps. And while these recent numbers have been encouraging on hospitalizations, positive tests, and some other measures, we're not yet out of the woods, and we should all remember that. And it's important that we continue to stick together and work together. To further support the Commonwealth's response to the coronavirus, earlier today I filed a supplemental budget bill that would authorize approximately $1 billion to cover costs that are related to COVID-19 here in the Commonwealth. These COVID-19 response expenses include PPE purchasing, rate adjustments for essential human service providers, temporary field hospitals and shelters, and the first wide contract tracing program in the country, and a whole bunch of other stuff as well. The bill gives us the leverage that we need to utilize federal financial support, like aid from the Federal Emergency Management Agency, so-called FEMA, which can only reimburse state spending resulting from eligible disaster response activities. The supplemental budget would also ensure that adequate state spending has been authorized to allow the Commonwealth to continue to support our communities until additional federal reimbursements are provided. We anticipate that COVID-19 costs that are not supported by FEMA reimbursement will, to the extent possible, be matched by other available federal revenue resources, including through the recently enacted Federal CARES Act. And we look forward to working with the legislature to get this enacted as soon as possible.